My name is Athanasios Nikolakopoulos. I come from Thessaloniki, Greece, and I'm vitreoretinal surgeon. And I would like to talk to you about the combination of vitrectomy and injections, intravitreal injections, and people are asking me all the time. And we had the case that needs surgery. If intravitreal injection is not enough, and which cases are that? The only sufficient evidence case that you need to stop injecting and refer it to vitrectomy is when you got a traction and macular edema with a traction, clinical proved traction, that it's mechanically improving, making a problem with the edema, withholds the edema in its place and doesn't go down until you remove the traction. So in this case, it's mandatory to refer to a vitreoretinal surgeon to do the injection. The other point is if you have hemorrhage, if you can inject freely. If you have a hemorrhage and you don't know the proliferation of the eye behind, if they have proliferative membranes, or if you're not going to do vitrectomy soon, to do injection in order to absorb the membrane or to stop bleeding, it's a very bad idea to my opinion, because this way you might induce traction and proliferation is going to be stronger, and you might be in trouble by doing that because you don't know what's happening behind. If you have a B scan that shows you there's nothing to, okay, it's acceptable, but usually we shouldn't do that. We should do these injections when we don't see, only if we're planning to do vitrectomy in a week or 2 weeks' time. And the third issue is how we support the eye after vitrectomy. Post-vitrectomized eyes need the injection, they keep a much better future if you inject a patient that already has vitrectomy for a proliferative diabetic retinopathy and already had laser. But if you do vitrectomy, if you do injection, I think you reduce the rebleeding issue, which is a very, very high problem for the vitreoretinal surgeons. Imagine to do a vitrectomy and then after a couple of months to have a rebleeding. So it's effective after the vitrectomy. I usually use some injection of anti-VEGF to keep the eye from responding until the laser gets in the way, because it takes some time to do that, to stop ischemia. So that's about it, that we can interfere with each other. And this is just a summary of what I do and what I know about this subject.